Good morning to all. I am Dr. Venkata Naveen Kumar P, Assistant Professor, Department of Pharmacology, Sri Lakshmi Narayana Institute of Medical Science. The today's topic for our discussion is source of drug and routes of drug administration. The competency number for today's session is PH 1.11. At the end of the session, students should be able to know what are the various sources of drugs, and the student should be able to describe the various routes of drug administration, that is oral, subcutaneously, IV, IM, and sublingual. And the student should be able to describe the advantages and disadvantages of each route. So before going to detail about the sources and routes of drug administration, what is a pharmacology? It is a science that covers all the aspects of knowledge of drug. And what is a drug? Any substance or a product that is used or intended to be modified or explore the physiological system or a pathological state for the benefit of the recipient. Drug nomenclature. Every drug has three names: a chemical name, a non-proprietary name, and a proprietary name. For example, the chemical name for aspirin is acetyl salicylic acid, and a non-proprietary name is aspirin, and a proprietary name, brand name, that can be Disprin or Ecosprin. If you see some of the sources of drug can be either a natural or a synthetic. A natural compound that includes plant products, animals, microorganisms, and certain minerals. Whereas synthetic, there may be drugs are synthesized genetically by using a semi-synthetic techniques and a synthetic techniques. Coming to the plant source, if you take the leaf of a plant, drugs such as distalis, digoxin are being where these drugs are source are derived from the leaf of a plant. They are mainly used in congestive heart failure. If you take the bark of a plant such as cinchona and quinine, the treatment of malaria, and if you take a fruit, opium, which is derived from a, which is drug morphine is derived from the fruit opium, which is we use as a analgesics. Plant source with their example and trade name and classification. Synconium bark, the trade name is pinidine. We use in the treatment of anti-arrhythmic as well as malaria. And purple fox clove, the trade name is distalis. We use as a cardiotonic. And papaya plant, we use the trade name for this morphine and codeine. We use as antidiarrheal, analgesic as well as anti-tussive agents. Animal source such as from pancreas of a cow, we extract drugs such as insulin, and particularly the regular insulin are been derived from the pancreas of a cow. Classification, it comes under anti-diabetic hormone, and similarly pancreas of a pork, similar insulin can be extracted, and it is also been used as an anti-platelet drug, sorry, anti-diabetic drug. In the stomach of a cow, where a pepsin is derived, which is a digestive hormone which act as a source. Most of the drugs that can be administered by a different routes, drugs and patient related factors determine the selection of the routes for the drug administration. These factors are characteristics of a drug, the emergency route we use, condition of the patient, whether the patient is in the state of unconsciousness, whether the patient is having severe vomiting, diarrhea. According to patient condition, we have to select the particular route of drug administration. Age of the patient and associated diseases. Factors governing the choice of the route depend upon the nature of a drug and their physical chemical properties of the drug also determine the uh, what route a drug to be administered, such as solid, liquid, gas, solubility, stability, and pH, and the site of desired action, the rate and extent of the absorption of the drug from the different routes. The major routes of drug administration can be categorized into three routes: enteral route, parenteral route, and topical routes. In case of enteral route, oral, sublingual, rectal route, whereas in the parenteral route, intravenous, intramuscular, subcutaneous, and inhalation route, whereas topical routes, transdermal, conjunctival, vaginal, and urethral. Enteral routes that includes oral, sublingual, and rectal. Oral routes, the site is swallowing of a drug through the mouth. The merits of this oral route is the most natural way of drug administration, and the most convenient way, and the most self, and it is the painless route of drug administration, and self medication is easier, and the patient activity is unchanged by this route. Coming into the demerits of these routes are, when the drugs that are given by oral route will undergo extensively first pass metabolism. If a drug is undergoing extensively first pass metabolism, the bioavailability of the drug will be decreased. There are drugs such as lignocaine, which is a local anesthetic, will undergo an extensively first pass metabolism. Another important drawback demerits is it is not suitable for unpalatable drugs. It is not suitable for oral route is not suitable for drugs are having a unabsorbed drugs like aminoglycoside, unconsciousness, and uncooperative patient, and it is not suitable for the drugs that are destroyed by the gastric juices, such as penicillins are destroyed by the gastric HCl, insulin and oxytocin by proteolytic enzymes, and it is also not suitable for the patient having a severe nausea, vomiting, and diarrhea, and it is not suitable um, for those patients who are in need of emergency because of their slow onset of action. So what is a first pass metabolism? The other name for the first pass metabolism is first pass effect or pre-systemic elimination. When the drugs are administered orally, they have to pass through the gut wall, through the portal vein and the liver, and enter into the systemic circulation. During this passage, certain drugs are metabolized and are removed or inactivated before it reaches the systemic circulation. This process is known as first pass metabolism, first pass effect or first pass metabolism. So those drugs that are taken orally will undergo the first pass metabolism, and these drugs will have the lesser bioavailability. Sublingual, the site if the drug is placed and allowed to dissolve under the tongue. The merits of the sublingual route is absorption is rapid, and these sublingual drugs that are having a quick onset of action, the sublingual drugs will bypass the first pass metabolism. The sublingual drugs action can be terminated once the desired action has been occurred, and the drug can be spitted out so that the side effect can be minimized. Demerits are Demerits of sublingual route. It is not suitable for irritant and lipid insoluble drugs, and the sublingual drugs are not suitable for drugs with a bad taste and smell, and it is also not suitable for children. Examples of sublingual drugs such as glyceryl trinitrate, isosorbate trinitrate for angina pectoris, and nifedipine for hypertensive emergencies. Coming to the rectal route, through the site of action is where the drug is administered through the rectum. The merits is it is useful for the patient having a severe nausea, vomiting, coma, especially for children. The other important merit is it avoids the first pass metabolism, and the major portion of the drug are absorbed by the hemorrhoidal veins. The demerits of rectal route is there is a high chance of rectal inflammation, and there is a absorption of drug that are given by rectal route is unreliable, and it is inconvenient and embarrassing to the patient. Example, diazepam for status epilepticus and indomethacin suppositories for rheumatoid arthritis. Coming to the vaginal route, here the drugs are administered locally in the vagina in the form of a processories. The important drugs that are given by this vaginal route are antifungal vaginal processories. Parental routes, routes of administration other than the enteral route are called as parental routes. It has a rapid onset of action, parental route, hence it is suitable for emergency. It is useful in unconscious patient. It is useful in uncooperative and unreliable patient. It is useful in patient with a vomiting and diarrhea. It is useful in avoid of destruction of drug by gastric intestinal juice and liver enzymes. It is useful in where a large volumes of drug can be infused by this route. Example, dextrose and normal cell, etc., are infused in a uniform rate. IV route drugs are here that in IV route drugs are injected directly into the vein. They are administered as follows: in a bowl, a single relative large dose of a drug are injected rapidly or slowly as a single unit into the vein. Example, ranitidine in bleeding peptic ulcers, and slow intravenous injection. IV morphine is used in case of myocardial infarction. Coming into the demerits of IV route, once the drug has been injected, it cannot be retrieved, and it is always we should maintain a strict aseptic condition is required, and the drugs that are given IV are painful if injected too fast, or there will be a sudden fall in the BP can occur when we are giving a drug in a IV route, and the intense of irritation to the vein can cause a thrombophlebitis, and accidental entry of air into the vein can cause air embolism is a remote but real dangerous, and self medication is difficult. Coming into the intramuscular route, where the site is the drug is injected into one of the larger skeletal muscle. Example, upper and outer quadrant of gluteus maximus and deltoid triceps. And the drugs that are injected by intramuscular route should be a soluble drugs, and a mild irritant can be given by this intramuscular route, and the suspensions and colloid injections can also be given in the intramuscular route. Coming to the merits, the onset of action is quick, and in this intramuscular, the drugs that are administered by intramuscular route will have the more predictable absorption, and the volume of injection that can be injected by intramuscular should not exceed more than 10 ml. And for the better absorption, the drugs that are injected uh, followed by applicant of heat or rubbing or massaging the area increases the rate of absorption by causing vasodilatation. Coming to the demerits of here, this picture shows that here the drug is directly in here the site of injection, where in the upper in the middle of the upper outer quadrant of gluteal injecting, where else in the gluteal there is a risk of hitting the sciatic nerve, injected directly into the middle of the each deltoid muscle head. These are the some of the sites of commonly used sites where a drug IM injection can be given. Demerits is strict aseptic conditions are needed, and the pain at the site of injection, and then there can be a risk of formation of abscess formation. Self medication is not possible. The chance of injury in nerve, inadvertent injection into an underlying artery or a vein can lead to a serious consequences. Examples of IM route or drugs such as antibiotics, antiemetics can be given by this route, and depot injections such as testosterone and neuroleptics such as haloperidol or perfenazine depot injections can be given by this route. Subcutaneous route, the site of subcutaneous where there is an injection into the subcutaneous tissue under the skin. In the subcutaneous route, a total of 2 ml or less than can be administered. Coming to the merits, when the drugs that are given by subcutaneous route, they will be having a slower absorption for a longer period of time compared to IV or IM, and it is the most reliable and self-administration is possible. Example, insulins are given in diabetics patient by this subcutaneous route where depot preparations can be inserted into the subcutaneous tissues. Example, Norplant for contraception. You can see this picture where the patient using where the picture of the fat on your stomach with the one hand and inject directly into the middle of the pitched fat, yeah, as indicated in the above in the photo above. So the drugs that are given by subcutaneously, all those drugs should be water soluble, water based injections where there won't be a irritants. There won't where that cannot cause irritants. Demerits is it is not suitable for non-irritant drugs. Drug absorption is slow, hence not suitable for emergency. Poor absorption in case of peripheral circulatory failure. Repeated injection at one site and lipotrophy may result in reluctant absorption. Example, insulin. Depot preparations injected for a longer action. Examples of the subcutaneous route are insulin, local anesthetic, and certain vaccines. The other forms of this route are dermojet, where a high velocity of drug solution is projected from a fine orifice using a gun. Here, the solutions get deposited in a subcutaneous tissue. In this method, needle is not used. This method is painless. Coming into the pellet implantation, here the drug is placed in a solid pellet and introduced under the skin. This provides a uniform but slow release of drug over a weeks or a month. Example, testosterone. And the third form is salicylic or non-biodegradable or biodegradable implants, where the drug is placed in a salicylic implant and is placed subcutaneously. Here, the drug is released at a slower pace over months and provide a constant blood levels. Examples in case of hormones and contraceptives. Intradermal injection or intracutaneous injection. Here, this intradermal injection or intracutaneous route, where most of the BCG vaccines and sensitivity testing are done by using this intradermal injection, where the outer layer of the skin is been used, where a small amount of a drug are used, and the rate of absorption is slow and is employed mainly purpose is BCG, giving for BCG vaccine and also for diagnostic testing and allergic testing. Coming into the intra-arterial route, where there is a drug is injected directly into the artery. The merits of this route is higher concentration of a drug can be delivered and the onset of action is quick. The coming to the demerits of intra-articular route is it is a great expertise and aseptic conditions are required, and this route is a dangerous and has a specific indications for diagnosis and as well as treatment. Examples are injection of a drug into a coronary artery for a coronary angiogram, or injection of certain anti-cancer drug is the main feeding artery to the tumor. Intraspinal or intrathecal, the site is injection into the subarachnoid space of the spinal cord. The merits of intrathecal or intraspinal route, here there is a direct access to CNS, bypass the blood-brain barrier and blood CSF barrier. The demerits of intrathecal or intraspinal route is strict aseptic conditions are to be maintained, and a great expert is needed, and a high painful and risky procedures and risky procedure. The examples are lignocaine in case of spinal anesthesia and certain antibiotics in the treatment of meningitis. Intraperitoneal route, where the drug is injected into the peritoneum. This intraperitoneal route is commonly used in the animals for experimental use, where the rapid absorption due to large surface area for absorption of a drug. So this is commonly used to anesthetize the animals. In intramedullary, where the site of injection is injection into tibial or a sternum bone marrow. The merits of this intramedullary route is onset of action is rapid, and vascular spaces of bone marrow communicate directly with the larger veins, so blood is given. And the another advantages by intramedullary route is the blood is given to the children via into the tibial or a femur. And also for bone marrow transplantation we use intramedullary route. The demerits is it is highly risky and a more painful, and expert and aseptic conditions are needed. Inhalation route, where the inspiration through the nose or a mouth. The merits of this route is the faster absorption and a quick onset of action, and the self administration is possible. This is one of the merits of inhalation route. Coming to the demerits of inhalation, bronchial irritation leading to the increased bronchial or salivary secretions. Examples of inhalation route, oxygen and certain general anesthetics are given by inhalation route. Certain drugs like salbutamol, beta 2 agonist in the treatment of bronchial asthma are given in a metadose inhaler, and in inhalation of certain sodium chromoglycate through spine inhaler are also been used, and also in prophylaxis to bronchial asthma. Tropical routes, transdermal patches. The site is here adhesion matrix. A patch containing drug is applied to the chest region or abdominal, upper abdominal or mastoid region. These are the common regions where a transdermal patches are used. The transdermal patches are mainly intended for systemic effects. The coming to the merits are, since the drugs are released slow but sustained release of the drug for several days. Demerits is, since the transdermal patches, some of the drugs can cause irritant at the site of application. This is one of the important demerit of transdermal patches. Coming into the examples with this dosage form, nitroglycerin is used for angina, scopolamine for motion sickness, and clonidine for hypertension. In conjunctival ointment or isotonic aqueous drugs such as sulfestamide, chloramphenicol, gentamicin, ciprofloxacin are applied or installed onto the conjunctival for a local effects. Coming to the cutaneous route, the highly lipid soluble drugs can be applied over the skin for a slow and a prolonged absorption. And drugs that are given by cutaneous will bypass the liver. So the first pass first pass metabolism can be avoided so that the bioavailability of a drug can be increased. The drugs that are given by cutaneous are incorporated into ointment or applied over the skin. The absorption of the drug can be enhanced by rubbing or rubbing and by using a oil base. Special drug delivery system. These are special drug delivery system. These are mainly intended in order to improve the drug delivery, to prolong the duration of action, thereby improve the patient compliance. Special drug delivery system are being tried. Drug targeting. To deliver drugs at the site where it is required to act is also being aimed at, especially for a anti-cancer drugs. Some of these special systems are occlusate, progesterate, and transdermal adhesive unit, prodrug, and osmotic pumps. Special drug delivery system in case of transdermal patches, adhesive patches for a slow and prolonged absorption affect the transdermal patches of nitroglycerin, hyoscine, chloridine, and estradiol are available. Coming to the occlusate, a special dosage form of pilocarpine are developed for the treatment of glaucoma, where the drug is placed beneath the lower eyelid. Coming into the progesterate, here the drug is given in a intraarterial contraceptive device, where the drug releases progesterone slowly over a period of 1 year. Now coming to the another drugs such as monoclonal antibodies, these are immunoglobulins which are produced by the cell culture and selected to react with a specific antigens. They are useful for the drug for target delivery of drugs in case of anti-cancer using monoclonal antibodies. To summarize, the example, phentermine, nicotine, and estradiol, here these are being designated for at least 1 to 7 days. These drugs becoming more popular because of they provide a smooth concentration of the drug without fluctuation. You can see there is a banking film, where under the film there is a drug reserve where the drug is been stored, and there will be a micropore. Through micropore the drug will be released slowly. So to summarize, there are three major routes of drug administration. One is oral route, parental, and a transdermal route. Oral route every route having its own advantages and disadvantages. Coming to the oral route, the drugs that are given by oral route will have the essentially first pass metabolism, and when the drug is undergoing essentially first pass metabolism, the bioavailability of the drug will be decreased. So this can be bypassed, this can be avoided by giving a drug by a parental route. And oral route drugs cannot be given in emergency condition, whereas parental route drugs can be given in a emergency conditions. So with this, I conclude my session. Thank you.